So I'm going to tweak my presentation a bit as I sat there being very nervous and waiting to go last, third time in a competition that I've gone last. I know what's going on because I practice what I preach. I wear a polar system primarily for self-studies, but all of my patients in clinical contexts use them as well. And the overriding question here is, does treatment work? And if yes, how do we know? Is it just because the patient says it does? Because the doctor or therapist says it does? Or both do? In many cases, the doctor does know, especially when biomarker changes validate beliefs. But in psychological contexts, patient self-report and or clinical intuition can be biased or influenced by the pseudo or dual pseudo placebo effect. And that's one of my realms of investigation, in which we attempt to use biomarkers as outcome measures to complement and possibly confirm or disavow or negate what a patient may think about themselves or the doctor, especially in psychological and psychotherapeutic contexts. So what should be done? One of the main things to do is attempt to validate self-report claims and clinical intuition by using biomarkers, essentially to determine whether an intervention or therapy or even pills result in positive changes from baseline. So all of my patients undergo baseline testing using biomarkers to see if psychotherapeutic, behavioral medicine, or even exercise pursuits lead to actual changes that have clinical significance and influence subliminal processes that you can't see. So essentially, we're using readily available biomarkers to validate what we think. And it's also important to bring psychological measures into this context. When we talk about artificial intelligence and things like that and big data, there's also a psychological human element, and traits and behaviors have been isolated that can predict compliance, for example, in the context of using a Fitbit or not using a Fitbit. Another issue is there's data missing in common, let's say, heart rate monitoring devices and things like that, because there's subliminal measures, including SDNN, which is a heart rate variability measure that nobody really talks about. Heart rate is spoken about, but that's a very superficial measure of fitness. Even usage or calories burned, and so very simple measures don't capture the entire spectrum of heart rate variability measures that one can get and assess, and that may have clinical significance. So over the course of psychotherapy, the goal is to measure baseline states, compare baseline states with heart rate variability, autonomic nervous system states down the road for comparison purposes, to see to what extent psychotherapy, behavioral medicine pursuits, or even the use of, let's say, a tracker, Fitbit, calorie burner, you have to go beyond just wearing. You have to become a knowledgeable patient. You have to become educated and realize that there's more behind the superficial data that's often used. So you don't want to sort of fool yourself into thinking that, well, if I do this and that, I'm making progress. That's just let's say a global measure that may not tell the whole story. So I guess the motto is to educate yourself about what you're doing, about the technology, and go beyond it so you can determine with a higher degree of certainty whether something works or not. Thank you.
Thank you. Okay, so I won't start or end with Christine, so I'm going to start with Rich.
Yeah, well, so first of all, really interesting. This is not an area of expertise that I have, so I've already know more than I did at the beginning of it, so thank you. I guess, the thing that I'm sort of struck by is, sometimes I think of PowerPoint sort of a little bit like, is it Spider-Man who said, with great power comes great responsibility. I kind of think that way about PowerPoint, actually, because PowerPoint really can be a great way to enhance a presentation, because if you are showing visuals that help amplify your story and sort of really help explain it in ways that words can't, it can be really useful. But I think the trap of PowerPoint is that it can be used as almost like an outline. And it seems kind of you were using it as a little bit like that.
It's funny because as the person who goes last, I'm doing all of these things wrong. So.
You're changing them on the fly.
Maybe I should go home and.
Right. Yeah. So and the other thing is, I mean, I was struck like now and at the beginning also that you have this great sense of humor, and so I would also really encourage you. To obviously you're thinking about how to be understandable here, but I really want a scientist to speak from here, speak from the heart. Like you care about this. Like let's feel your passion for this a little bit more. So,
okay.
Yeah. Thank you, though.
Thank you.
Carrie.
So, yes, agreed. Also, I would say best not to capitalize the beginning of each word on a PowerPoint. We do that in our headlines, and I think it's actually sometimes distracting. And then my overarching was, it was fascinating. It really pulled me in, including the question of how do we know if treatment works? And then I was waiting for you to get to the placebo part, and you didn't quite get there, but I thought where you were going was that we can use autonomic measures and trackers and so on to identify biomarkers that show whether the treatment actually works or not. But then I was confused because I think of biomarkers as being sort of not wearables, but blood measures. Yeah. So, so you really grabbed me, and then I felt like overall more concreteness could help. Like, let's say you just got treated for depression. We could measure this, that, and this. And then we could tell whether it's not just going to be you checking off a checklist of how do you feel. We would actually know some concrete things. So that's my main suggestion is more concreteness, but it was great.
I'm also a sports psychologist, and I feel that I choked, so.
Okay, Christine.
Roland, I'm going to empathize because I want to say that I was very glad I went first. So I got to receive my own criticism. And so I just want to emphasize to all of you that I think I've been really excited to hear about all of your research. I learned so much from all of you, and I think sometimes we forget that when we're kind of doing these critiques, but I've learned something from all of you, and that's the purpose of doing this, so thank you. I would agree with some of the sentiments that were echoed around the use of PowerPoint. And the one thing I would add is that I really liked the topic of your research around kind of who has the authority to know whether or not you're getting better. And that is a very brave question. And so that for me was important, and I also liked that you ended with an action statement for the public of becoming a knowledgeable patient is really important. And so that also often gets lost in science communications, thinking about what does that mean for all of you here. So thanks.
Thanks, Christine.
So I really liked on your first slide how you laid out the questions, because it was a very complicated question that had a lot of parts, and I think that while I generally agree sort of trying to avoid like the outline PowerPoint format for the rest of it, I thought that first slide was one where that might be where that worked effectively, because we could sort of see one part of the question leading to the next and didn't have to keep track of them all in our head. So I thought that was an effective way of laying that out, and I think I would just echo, Carrie, what you said about sort of more specifics toward the end, because I think, I guess it was on this slide, I sort of thought that the first half of it was going to be a little more specific, but we were still in the general sense. Then when we got down to the specifics, I was just a little bit sort of lost as to how they connect to what we were talking about before.
Great, thanks. Thank you, Roland.
Much nicer than American Idol.
Yes, exactly. We didn't have a Simon, I don't think.
Yeah.
Simon. Thank you, Roland.
Thank you.